and Brad, the two most famous physical therapists on the internet.
Hello folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of
You
course.
looked a little confused there for a second, Brad.
I usually am.
Somebody's knocking on our door. Okay, today we're going to show you how to make a knee replacement scar look good and feel good.
Right, absolutely. This is fun as a therapist because after a knee replacement, there's this incision. Sometimes you got staples in it, sometimes they glue it, whatever. It doesn't look very pretty the first few weeks after therapy, but there's not much you can do with it right away. After it heals, and if it's stapled, they take the staples out, and there's no scabs on it. And before you do this,
no open areas.
No open areas.
Right.
And this is one of those things, if you have any doubt, you need to ask your doctor, the surgeon. When can I start doing a soft tissue massage to make the scar look better, get rid of that scar tissue that is underneath that
You'll
incision.
see that overgrowth a lot of times where it just gets big and ugly.
No, yeah, I just had one this week, Bob. That's why I really wanted to do this. I don't know if you can come in on this, but this woman had a really bad overload that was about like this. And I'm not exaggerating.
No, and I've seen them myself. So
it wasn't this long, but it was about a half inch, and I had never seen one this bad, and I didn't know if it was going to come out or not, to be honest with you.
whether or not it was going to respond.
Right.
Yeah.
All that scar tissue in there had been there since, growing since surgery, if you will, and it's like, we got to get this broke up. So incision was healed well, and all this to do is very simple. You do a cross-friction massage. We talked about this many times, or a number of times in the past. You go on the incision and you go across. The incision goes up and down, you go perpendicular, and you don't do it on the surface.
No.
You need to get down, and you're going to feel, one thing you're going to notice if you do this and there's a lot of scar tissue, the whole scar is going to move. Everything's going to move together because all that scar tissue is in there. You got to get in there, and I'll actually do some circles, and I'm pushing. And if I do this for about a minute or two, I have to stop because my fingers get tired and a little bit sore. And that's what I say, it's good for the day.
I've seen also, because that scar can be a source of pain too.
Oh yeah.
So,
right.
And especially if you put your fingers on the scar and it feels like it's bound down, this will help that also. It'll help decrease some of the pain and that binding that can cause pain.
And range of motion. It'll help flexion.
And range. The other thing I've done, Brad, sometimes is I'll have people even like put a finger here and then pull like this and pull in every direction.
Yep.
And if it hurts in one direction, that's the way you do it, believe it or not. That's the direction you want to break up. So again, that's where you got to really make sure that scar is intact, that you're not going to open up the scar again.
Exactly.
Don't make us responsible for doing something like that. Make sure it's very solid before you.
And another thing is, almost always when you start, it might be a little painful, but within 20 seconds to 30 seconds, that pain level should go down. If it's just more painful, it may not be ready for it.
Yeah, good point, Brad. It just may be too soon to do it. And I've even had people just go like this, Brad.
Sure.
Back and forth, sawing like this.
Yeah, I like that technique as well.
A lot of different ways you can do it, but all with the same goal in mind, trying to break up that scar tissue. And how did yours turn out then, Brad?
It was amazing. That's why I really wanted to do this, because I started this Monday, and then I did it Wednesday, and another therapist had worked with her. She came over, who I worked with the week before, and she just was in awe because that big bump was completely gone, and it was smooth, and you can see in another 6 months, it's going to be
almost gone.
Yeah, almost invisible. You're going to have to look for it.
So, yeah, if you want to keep a pretty knee, this is what you're going to have to do.
You better believe it.
All right.
Yeah, get this one out of here.
Yeah, this is bad.
There's no hope for that knee.
Thanks for watching.